So, cervical cancer is preventable, yet still, so many of our women are dying. Every year, over 500,000 women globally are diagnosed with cervical cancer. Quarter of that amount die. In the Americas, the region where I live, over in 2012, the Pan American Health Organization reported that over 83,000 women were diagnosed with cervical cancer and 36,000 died from the disease. Remember, those are the reported cases. But what about the cases that weren't reported? So cervical cancer is preventable. How? By doing regular screenings. What are the screenings? Pap smear. A pap smear detects abnormal cell changes on a woman's cervix. If a woman does a pap smear and there is precancerous cells, there's various procedures that can be done to remove those cells to avoid it from becoming cancerous. I personally call it ending cervical cancer before it even starts. The American Cancer Society recommends that cervical cancer screening should begin at the age of 21. Doctors who operate in my region, the region of the Americas, advises that cervical cancer screening should start at least 3 years after their first exposure to sex. I go with that one because I personally know with girls who are 19, 21, 24, not just have cervical cancer, but I know one 24-year-old who actually died from cervical cancer. So go out there, speak to your doctor about a pap smear, get a pap smear done, educate yourself, educate those around you about a pap smear. Men, get to know the facts as well. Speak to the women in your life about a pap smear. It's important. Women do not have to die from cervical cancer because it's preventable.